You may have heard a spot on the radio recently reminding women if they are pregnant to think, don't drink. It's all part of a statewide campaign to raise awareness about fetal alcohol spectrum disorders. Well, joining me now is Dr. Mary Alakwa, the Ob-Gyn department chair at Samaritan Hospital and a member of the American Congress of Obstetricians and Gynecologists, the ones producing the statewide campaign. First, can you tell me about this campaign and why it's so necessary?
Well, since maternal alcohol use is the leading known cause of mental disabilities and is a preventable cause of birth defects, ACOG, along with other organizations, is committed to educating the public about the consequences of using alcohol during pregnancy. There are over 40,000 national births of babies born with fetal alcohol syndrome. So this is a very important campaign to educate the public as well as obstetric providers to improve care and prevent this terrible syndrome.
So tell me what does happen when a mother does drink and the baby is inside.
When a mother drinks, the baby drinks. Whatever a woman ingests passes through the placenta to the fetus. And we know that alcohol creates toxic metabolites that can impair the transfer of oxygen or delivery of oxygen to vital organs, as well as impairing transfer of other elements such as zinc, etc. And this can cause severe physical malformations as well as cognitive impairment. These children who are born with fetal alcohol syndrome have smaller brains or microcephaly. They have facial deformities, which can result in sensory, visual impairment, smaller eyes. Their average IQ is about 50 to 70, and they have behavioral issues as well as cognitive impairment.
Now, it seems that most women would be aware of this by now. I mean, we've been talking about this for years and years and years.
Well, I think we need to remind women that there is zero tolerance. This is not something that we can take very lightly, and alcohol use as well as drug use have increased in the United States over the last several years.
For pregnant moms?
For all women.
For all women. When we think about our mothers or our mothers' mothers, most of them had a drink or two back then. They were even smoking cigarettes. All of those things were happening, and women will say, well, look at me, I turned out fine.
Well, we have progressed, and there's also varying susceptibility with regards to the potent effects of alcohol. Each pregnancy is different. However, some of these effects are potentiated by older age, smoking, poor health. So I think we can't really say one is too little and three are too many. We need to say, just say no.
Just say none at all. All right. When you do have a woman who you know is drinking, what can you do to help that woman?
Well, brief interventions have been shown to be successful. We do have educational videos. I think it's important that women should talk to their health care providers. Don't be embarrassed by this situation. We're there to help. And again, you can go to our website, and we have specific organizations that are available.
All right, great. Thanks so much. And of course, if you would like help, just go to our website. We will tell you more about fetal alcohol spectrum disorders. We've linked you to ACOG's website.